I just want to affirm, I think you probably all realize it, but what an extraordinary organization CLOC is, and how lucky you are to have it here in Chicago, and I hope it has everyone's loyalty and commitment. Obviously, this is a full room, and I've really been happy to be an advisor and a participant in CLOC's development over the years. I think you're doing some really important work, not only for Chicago, but that has national implications and national impact. I think I want to start this discussion today by talking about a meeting I was at a couple of years ago. One of my favorite meetings is called Coffee. And I was having coffee with a colleague outdoors in North Beach in San Francisco. Someone came up to us who recognized her, didn't know me, and started asking me about my work. And as I started talking about my work, she actually started crying. This is kind of surprising, disconcerting, I guess. And I asked her why, and she said, I'm a physician. I met someone today, and in the process of figuring out what his health issue was, I realized he had very severe diabetes and wasn't aware of it. And I had to tell him that, and we talked about it, and I knew and confirmed to him that it was very, very important for him to start taking medication. And as important as taking medication was that he would start to exercise more and eat well. And I told him that. He nodded his head. It was very clear he understood. And when he left the room and closed the door, I felt like a hypocrite. I knew, and he knew, that in the neighborhood in which he lived, and given his work situation, it was highly unlikely when he came home late at night that he could walk around, because it wasn't safe to walk around. And he wasn't going to be able to go further away to the stores where he could get healthier fruits and vegetables. It all was an impediment because of the safety of his environment. And I realized that unless I deal with his environment and write the prescription, not only the what's called green prescription telling him to walk more and to eat better, but somehow the prescription to my bosses saying, as a health system, we need to work to make the communities safer, I wasn't doing my job. It had always seemed obvious to me that there's a strong link between safety and healthy eating and physical activity. In fact, so obvious, and a lot of different links, that it really wasn't important to describe them, write about them. But I learned through encounters like this that unless we voiced this, it wasn't moving forward. Because there are people who are working in violence prevention work, and not that many people working in violence prevention work. There are people working in violence prevention work who are not thinking about nutrition or activity or those kinds of health impacts of the related diseases. And there are people who are working similarly, like so much of the work that CLOC does, where it's just kind of hard to move in or get a handle or play the most strategic and supportive roles in violence prevention. And thirdly, I'd say there are lots of other ties as well. When we think about what makes a community thrive, how a thriving community benefits our health, our well-being in so many ways, it's time for us to better make those connections. So what I want to do today is talk a bit about those connections, what we know, give you a whole set of different examples of different pieces of it. Interestingly, I went to a meeting not that long ago, right outside of Delhi, India, where they were talking about making the community of Delhi safer and more physically active, and getting people physically active, and dealing with climate change by having more public transportation, and realizing that safety, both in the sense of being safe when you're on a bike or walking, and safety in the sense of violence prevention, were absolutely critical to that. And so I've got a couple of international examples I want to share with you as well. I also want to use this, as Adam said, we've developed a number of tools, and I want to use this as an opportunity to share a couple of tools as well. And then at the end, very quickly, I want to mention the potential links with some of the work going on with healthcare and health reform. So that's a lot to cover fairly quickly. So fortunately, before being a mellow Californian, I was a New Yorker, and I can talk very, very fast. Starting with this, and this raises the question that Adam and I talked about at lunch about intentionality, that there are lots of things that make our communities thrive more, but sometimes it's really important to pay attention to violence prevention. Little known fact, the Washington, D.C. subway system was deliberately designed to reduce violence and related crime. It's pretty much the only transportation system where that was thought through from the beginning, and certainly not because D.C. is a safer city, yet their rates of violence and kind of heavy-duty crime are about 1/3 of other transit systems. So to me, that's a statement of that deliberateness in strategy makes a lot of sense. And needless to say, we fully understand that if there's safe public transit, we're talking about walkability. We're talking about more physical activity, because those things get intermixed as opposed to people getting in cars, not taking public transit, and discouraging those who are biking and walking. So as I say, we felt we needed to document this. I think this is about a 4-year-old document. You have the executive summary, was passed out when you came into the room, the full versions on our website, preventioninstitute.org. But we simply wrote this paper to start to address the links. And we did it simply we reviewed the literature, but we also talked to coalitions. In this case, it was funded by Kaiser Permanente of Northern California. So we talked to coalitions across Northern California in different communities and asked them about this issue. What's important to understand, of course, is we're talking about the environment. It's unreasonable to expect people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. It's unreasonable to expect people to be more physically active, to go the extra distance to shop, to not be fearful, to take better care of themselves when they're worried, when they're scared, when they're post-traumatic stress or constant traumatic stress disordered, when the environment is conspiring against such change. And so the fact is, the good news, as the DC transit photo showed, is we can have a pretty big impact on that by being intentional about it. So some pictures, make this environmental link with behavior very clear. America's Top Model, this is a photo shoot. Somehow it's seen as sexy that someone's going to be dealt with violently. This is obviously about public transit and physical activity as well. This was a General Motors ad in every college newspaper in the United States. It was part of a series that basically said, it's not safe to be on the bus, and fortunately, there's an affordable alternative. Why don't we all stop walking and using public transit? Why don't we recognize that the common public's not safe, and why don't we move on to cars? And fortunately, they don't do that anymore, but this was part of a whole series of ads. Typical of low-income community, this is in Orange County, California, one of the wealthiest communities in the country, but this is the low-income part. Young child comes out, says, I'm going to be physically active, I'm going to play. Nope, no children allowed in the courtyard, so he goes to the park, or she goes to the park. What do we see there? The very same sign. Where do the kids end up? Here. Safety in a lot of different ways. I added this one to cheer you all up after the other pictures. Another one not so cheery, What are the norms we're creating? How are these norms associated with violence? What is this saying? What is this saying about healthy eating? What is this saying about women? Another one, let's throw some alcohol in there. You know, what's the association with women as objects and alcohol and violence toward women? How does that relate to self-respect, to healthy communities? This one's more on the unintentional injury side, the walkability side. Can you see that in the back? We've got a couple of alligators on the side of the road. Somebody sent me this picture to basically say, you know, at first you may think the injury we see here is the alligator bites, but of course it's not the alligator bites, it's the attitude toward walking, it's the attitude toward physical activity. And going back to the park theme, this is someone being very clever in New York. So they do have a park where kids can exercise. What's the message that they're giving? And so that's why we have to think about, and this was an article in the Oakland Tribune where I live, we have to think about life in the killing zone. And of course the equity issues. Poor people and people of color more likely to live in neighborhoods receiving less public and private investment in infrastructure, more feeling of disorganization, unsafety. It's not just violence which is the problem, it's fear and perception of violence which is the problem, which is going to lead to less walkability, less physical activity, and I'll document that a little later. But first I wanted to link this to the issue of equity. In my home in Oakland, but it's the same here in Chicago. You know, the famous Bay Bridge. This is the now torn down bridge as of a couple of days ago, though they haven't torn it down yet. But the bridge to Oakland, the new Oakland Bay Bridge. An African-American child born in the flatlands will die on average 15 years before a Caucasian child in the hills. And of course, it's a whole set of factors, but I think we can understand how those factors are interrelated. For every $12,500 in family income, we're talking about an additional year of life expectancy. You know, is that diabetes? Is that asthma? Is that violence? Obviously, it's the environment which promulgates all of that. The health inequities we see are not just about individual bad choices, they're about things not being fair. So this was a very good policy campaign that dealt with all those issues. It dealt with violence, it dealt with eating and activity-related diseases, it dealt with other diseases by saying, it's not your genetic code, it's your zip code. And took two actual zip codes. This poster was put up by California Endowment, our largest prevention funder in California, in the airport in Sacramento, so that all the politicians, when they came and went each weekend, would see this and be reminded. And most creatively, most importantly, it wasn't just a message. As you can see on the right side of the screen, it delineated 4 pieces of legislation which directly related to these issues and said we can do something to move that situation. So the point of all these pictures, and I've shared this slide before because I think it's important, is that we need to understand the role of the environment in terms of how it links to our health and our safety. We understand that with air, water, soil, of course, that relates to our health and safety. But the environment also shapes the way we behave, the norms that shape the way we're behaving, and ultimately in that way our health and safety as well. So it's critical to look at the environmental cues which relate to violence, which relate to healthy eating, which relate to healthy activity, and that's why we put together this document. So let me share quickly what we learned. We learned, to put it simplest, that violence and fear of violence affect our behaviors around eating and around activity. If we're afraid, as I said, we're not going to walk as far, we're going to choose the hours when we walk, and if we happen to be busy those hours, we'll wait until the next day or the weekend. You know, if we've experienced violence, we know this. It has an incredible effect on all kinds of different undereating and overeating disorders, the desire to take care of ourselves, but also violence and fear of violence have an impact on the entire community. And they diminish the community environment. Because when people stop walking, less stores open. When less stores open, less people are outside. Even more stores stop opening. And so violence not only affects where we work, where we live, you know, where we go to school, how we recreate, but whether in fact people are going to school on a regular basis, whether there's a workplace in the neighborhood, whether there are stores to shop in. You know, it's inextricable, these links, and fortunately there's things to do about it. So as I said, in the study, we not only read all the literature, we talked to the community. Here are 3 quotes. Reality and perception of violence are justifications for people not outside, or even more so, for letting children outside and for not walking to places that they normally would. That was a community leader of a coalition. Turf wars deter people from walking to grocery stores. And we have a wonderful gym in the park, but the kids don't use it because they're afraid of the park. I was at a meeting at the White House. It was the first meeting of the Obama administration for cities, and it was on violence prevention, mostly city leaders, attorney generals. I sat next to the head of security for Target stores, and he said to me, community safety is our #1 concern. If our employees aren't going to feel safe coming to work, or we think patrons will be scared to shop in the area, we're just not going to open a store there. So then that has an impact on the community, then that has an impact on the people. That cycle continues. We've done a number of fact sheets on our website looking at linkages, the linkage between violence and chronic disease, violence and mental health, violence and learning, also one not on this picture, looking at the links between violence and equity.
I'm also on right now, so yeah, sounds like it's working for everybody. Let's try that one. And these are a little bit louder now, I like they seem louder than they were before, but
they are louder. So let me just take a minute and ask, how do people see this playing out in Chicago communities? Are the things I've talked about so far, do they resonate with people?
Yes, absolutely.
One of the approaches I want to share is a tool called Taking 2 Steps to Prevention, and how we can look at this issue and the notion of how do we move from the medical conditions such as eating and activity-related diseases, how do we move from that to the environment? And you can see the trajectory, and hopefully we start to move it, not the environment shaping injuries and illnesses, but quite the opposite. How do we move it so that we change the environment so that the shape is positive? And I wanted to start with a book a friend and colleague, Fran Kaufman, wrote, Diabesity. I don't know if you've ever had her speak, but she's a very interesting speaker on her work, combines prevention and treatment. You know, clearly, you know, what we're going to think about first with diabetes is healthcare services, how important they are, how we must have quality healthcare. Clearly, you know, one of the major causes of death, one of the causes of cost, one of the key inequities. But what if we take a step back and say, let's look at exposures, let's look at behaviors. Of course, Clark has done that a lot, and we see pictures like this. You know, the schools, we see pictures, the kids at home, you know, watching the TV, being physically inactive. Of course, the TV interplays with the poor eating behaviors that we all snack when we're watching our TV. And all these links are very common, interrelated, multifactorial in terms of community. But quickly, let's take the second step back and say what in the environment is shaping that, what in the environment is driving that. And here's a park. Now, this is a park that should be, but isn't. And we did a photo voice project, and it was actually a young teen named Daisy who took this picture. And here's what Daisy said. It's one of the most moving things when you really hear it. We could use this place as a place to play sports. We don't get to interact as much because we don't have places to play. The bond is broken. Imagine a 13-year-old saying to us adults, the bond is broken. We could build a park so that kids my age can stay active, healthy, and connected. And then we have the parks we have built, but if we don't keep them safe, we don't have the parks. And there's lots of ways, if we all work together, we can make the parks safer. I want to raise the inequity issue. There's a study in LA. Guess which of these was acres per 1,000 people? Guess which ethnicity, Black, Latino, Caucasian, had the most? Guess which had the least? Predominantly white neighborhoods, quite a difference. African American and the Latinos, being newest to LA, had by far the least. This is the alternative. This is what we can do instead of that fenced-in space. So it's clear then, isn't it, how if we take 2 steps back, we see very clearly we can move from an unhealthy to a healthier environment, and that'll have effect on our exposures and behaviors. But that fenced-in space will only work as a park if we not only make it a place to be active, but we make it a place that's safe to be active. And so one of the most important ways to address the intersection of healthy eating activity and safety is by creating safe spaces. Also by creating community development, employment, it interplays, and finally by fostering social cohesion. These were some of the conclusions. Let me just show you some examples. This was an article I read in New York City in the New York Times recently. I loved because I grew up going to Prospect Park in Brooklyn, but I always knew that you had to stay on the outskirts because it wasn't safe. You know, someone came in and said, I'm going to change the park, and I'm going to change its dynamics. I'm going to make it safe. I'm going to engage people, and this is the way it looks now. I love, as a dog owner, that one of her first strategies was to allow people to walk their dogs off leash, because you started getting people in with dogs, having it died now, but having had a German Shepherd recently, and knowing when I walk around with my German Shepherd, I'm very comfortable in park space, and it not only makes the space safe for me, it makes the space safe for everyone. And there's been lots of issues, of course, in neighborhoods around, wild dogs, and this is the opposite of that, and she was very, very shrewd about it. Lots of other strategies. By making the park safe, she changed the experience of all the people in the greater neighborhood around the park. Recently, our work with Convergence Partnership, following the report I shared with you, we funded pilots in 6 communities to basically show whether, and this was small pilots, it was $80,000 over a year and a half, to show whether the communities could start to build some momentum for safety that related to physical activity or nutrition. This was Philadelphia. They focused in this picture on building a garden in the middle of the park, bringing people in. So there were periods of time when the park was safe to be physically active by growing food, getting kids to love food. Other examples, joint use agreements where existing space is opened up, emphasizing that safe routes to school means designing the route, partnering with the businesses along the route to make it safe from violence, to give kids safe havens, after-school programming, paying attention to aesthetics, safety features. In Chula Vista, there was a vacant Boys and Girls Club. The community started to encourage that because it fronted the park, we needed to do something about the space so that people could feel safer because there was an occupied building instead. Here's Medellin in Colombia, a community known for being unsafe. They started having more open spaces. They made sure all their public transit was safe. They started paying attention in everything they did to safety. And now the community is a model of safety. Safe routes to school, as I said. Parents didn't allow children to walk. They created a walking school bus. They said, we're going to walk with them. And they also created a No Sales 40 initiative banning the alcohol around the park. because the alcohol around the park became the mechanism of people buying it, going to the park to drink. Huge improvements. This is, people always ask, where's the evidence? In South Central LA, after the Rodney King issue, a number of the liquor stores burned down. Many things burnt down in that neighborhood. And the city council said, we're going to fast track everything and get it back open. This was horrendous. We need to give people their stores back. A bunch of neighbors said, wait a minute, there's a bunch of liquor stores here we've been trying to close for years. Why are you opening them back up? The reason they were burned down is because there's so much community outrage about the damage. So finally, 200 liquor stores were not reopened in the next 3-year period. A study showed a 27% reduction in crime, particularly serious crime and violence, and you can imagine the other harassment. And all of a sudden, people were walking around their community who previously had not walked around. An even more dramatic example was in Diadema, Brazil, where they looked at linking land rights and alcohol abuse. I won't describe it now, simply for the case of time. Community development, employment, looking at healthy corner stores program, incentives to food retailers to create a sense of health, a sense of well-being, a green economy, job skill development in the healthy food sector, all having the impact on healthy eating, of course, but also having the impact on deliberately improving environments. And finally, another win-win is social cohesion. And this is a picture, you can't tell much from the picture, but it was a group of women who started a walking group in a neighborhood that wasn't safe, so they started walking together. And then actually they went from not only walking together, but being advocates for safety and for healthy eating and physical activity in their communities. And this group is now a powerful political force as well as a regular walking group. So the cohesion has obviously multiple impact. A lot of this requires interdisciplinary collaboration. We're doing some work right now to identify ways that groups can really work together, that we need every sector to think about these issues. All these sectors here need to enter into partnerships. We know interdisciplinary collaboration really strengthens outcomes because it brings together diverse expertise. It provides access to more constituencies. So what if we start to deliberately foster interdisciplinary collaboration, which pays attention to physical activity, to parks, to healthy eating, to safe spaces, to law enforcement, to all the walking and biking, and we do that at the same time and say, wait a minute, these are shared goals, these are common areas. What if we pick a particular issue like parks and say our parks must be safe? What is the multifaceted strategy to achieve that? So we have this tool, I'll just show it to you quickly. It's called Collaboration Multiplier, to really do a thorough analysis of what different sectors can do. Needless to say, although I'm showing to you about this topic, this is useful for a good deal of the work you do on many topics, and I'll document it through another wonderful program, which was a pilot, which was in Denver. They took the least safe park in the city, the least safe big park, and they said, we're not going to do a garden, we're actually going to encourage urban farming. They brought young people together, they got involved in the farming, they worked with a number of sectors to say, how do we make the community safe? Just for a case of example, I'll show these 4 pieces of the jigsaw puzzle, and they said, what can public health do? Urban agriculture, the violence prevention groups, city council. I know you can't read this, but just for an example, there was the role of public health and what it provided. And then we say, what are the outcomes? What are the strengths, the activities? And some of the outcomes were stronger partnerships, that there was a safe community gathering space because there was intentional collaboration between these sectors. There was employment for youth and adults, increased access to healthy food, and systems and policies starting to change. So that's what that all looks like, the very clear notion that a good solution solves multiple problems, and we need a solution right now to all these interrelated problems. I wanted to talk for a minute about violence, kind of more broadly and not specifically related to eating and activity. And we have some colleagues who will be speaking later in the day, several of whom I know and honor, who are doing incredible work. And I'm really, really happy that they're going to be here. The key is that we need to do it together. As my colleague Deborah Prothero-Stith says, it's not the problem of one neighborhood or group. All the solutions are central. We've been working on a project the past 8 years, which has just ended, bringing together cities across the United States. It's been called Unity, and Chicago's clearly been involved in that, Becca and Ceasefire and others. We've been basically saying we need a comprehensive policy platform that the cities develop together. It's not just one program. We need a roadmap. We need a series of strategies. We learned the cities that were most effective were the cities with the strongest partnerships, not the cities with one particular program. Fascinating information. It was when people collaborate, it has the biggest impact. An example could be Minneapolis. Within a 2-year period, they saw a 64% decrease in homicide. And a lot of the strategies we're talking about here, community development, making the parks safe, encouraging people to start working together, encouraging people to think together. It's got to be a comprehensive approach. It's got to be individual information. There's got to be community education, but we've really got to have an impact on norms that only happens through partnerships, that only happens by changing our organizational practices and policies. Those are the tipping factors to changing norms. Here's an example from Salinas, California. The city council in Salinas, California said safety is our #1 problem, and in fact, it's not just violence, it's fear of violence, because people are not coming downtown anymore. So the city council said, after we did this work, they said, every time someone comes to the city requesting money, any proposal, we're going to evaluate in terms of what is it doing to make the city safer. And if safety has not been considered, or there's not a clear expectation of effectiveness, we're not going to pay attention to it. And of course, putting that on everyone's radar screen led to a much safer city. 2 years later, polling showed that there had been about a 70% increase in people's comfort in walking around downtown. And of course, we could see how then that would build in lots of ways. Finally, before ending, I wanted to talk a minute about health reform. You know, this was the president's quote: in the absence of a radical shift toward prevention and public health, we're not going to be successful in containing medical costs. I would say unless we deal with eating, with activity, with safety, we can't succeed. Here's Laura Gottlieb saying, I diagnosed abdominal pain when the real problem was hunger. I confused social issues with medical problems. I had neither the skills nor the resources for treating them because I ignored the social context of disease altogether. I hope I've given you a feeling of a bit of what the social context is and the crossover between safety and physical activity and food issues. Rachel Cleaves, who was involved in the Denver project I showed you a minute ago, what I have always known is that it's important to address violence while I'm promoting healthy eating, active living. But the issue always seemed something outside of my scope. And I did not have the tools or understanding to deal with this issue. She went on to say that through the partnership work, through being intentional on safety and saying, what is the crossover, how can we work together, she became much more effective in dealing with that. And the park now and that urban farm is flourishing in Denver, in a part of the neighborhood where previously no one would walk. So what it's really about is building a movement. You know, it's really about doing the work together that's community transformative work and being really, really intentional about it. Albert Einstein said, intellectuals solve problems, geniuses prevent them. That's not true. It's not a question of genius. It's a question of knowing what to do, and it's a question of political will. There's probably 125 people in the room. That's a lot of political will That's a lot of capacity. We need all our voices to build that kind of movement. I think we can build all that kind of movement. People have stayed away, philanthropy has stayed away, government has stayed away from the violence prevention problem. All the investment is in law enforcement. We know what to do to prevent violence. And we've seen some of it here in some very important work going on in Chicago. Right now, we could cut the rates of serious violence by 50% with the money that's being spent if it was spent more wisely. It's simply a question of political will. In the time we were working in Unity, we've seen violence drop nationally and in virtually every single Unity city. We can do it, but we won't do it unless it's a question of engaging our political will. And in terms of eating and activity and community health, it's an essential element, not foreign, not impossible, but looking at the crossovers like the park and saying, what do we do precisely to make our parks safe? If our airports are safe, our parks must be safe. If our airports are safe, our schools must be safe. And it should be safe to get to school, to walk to school. If our airports are safe, our public transportation in the community must be safe. We know how to do that. So that covers it. I hope this was helpful, and we have a couple of minutes for Q&A. I wanted to say quickly, we have lots of tools, lots of issues. We have a textbook because we think we need to change the thinking of the medical community on this. It's called Prevention is Primary. Although that's got a gun in it, that's a video about tobacco. Adam mentioned I did the first no smoking coalitions, and the next day somebody from a place called Tobacco Institute came and offered to bribe me, said, Larry, what do you need to not do policy? Keep doing education, but what do you need to not do policy? And I did a really interesting, I have to say it even though it's me, a really interesting 8-minute video on kind of that story that you can just watch on YouTube. And I actually have, and I'll distribute it at the break, the postcards for this We're Not Buying It, which is a 2-minute video about deception with food and how food marketers are saying it's good for your kids when they're saying it's good for our bottom line. So I want to give everybody a postcard before you go, and hopefully you can watch the video and share it with others. Our work on community-centered health homes is how do we build the match between this and the healthcare community. Spectrum prevention, I mentioned, 2 steps to prevention, collaboration multiplier, other work on coalition building. And we've documented, because it's really communities, and as I said, Chicago is one of the leading communities. The panel that we have and the speaker before the panel, well representative of some really exceptional work going on here. Coming from Oakland, which right now is one of the few cities where violence rates have not gone down, and where there's some horrendous number, like 1 out of 97 people was burglarized last year. It's very clear that our level of law enforcement is too low. It's also very clear that the law enforcement is done wrong, and it's also very clear that the full amount of money spent not just on law enforcement, but law enforcement, probation, unnecessary and necessary incarceration, the kinds of incarceration, the length of incarceration, the whole process is inappropriate. It's not always law enforcement, I don't think, which is our biggest enemy, though if we start to be more successful and change the nature of law enforcement, I think we can aim for some of those conclusions and some of those modifications. But frankly, although I'm really a strong prevention advocate, I think we need partnerships, we need more effective law enforcement. But there's other areas within criminal justice where the money is spent really badly. And anyway, if we just started investing in jobs, I mean, I've had people tell me, oh, we're really engaged in prevention, and we're getting people after prison and we're giving them jobs so that they don't have to go back to prison. That's great. What about doing that before people go to prison? What about creating, so that what we're saying is, to the port, you have an incredible responsibility in violence prevention. To the economic development people, you have an incredible responsibility in violence prevention. To the transportation people, and of course, to law enforcement. And I think clearly what you're saying is on the right track, but I just think we have to manage it very, very carefully and not overstep, which will lose political will and create an adversarial situation, and also which in some cases may not be as effective. But eventually that's where we need to get. Everything we're doing now, what if we, and everything that we all touch, what if we deliberately designed for safety? What if we're talking about walking kids to school and we said, how do we make sure we design that for safety? What about every time we're talking about a park program, we say, how do we design that for safety? And when we think about how people are going to get there, how do we design the public transit for safety? We're not able to do every one of those things, but simply by being engaged in that screen, simply by people who are involved in other issues like eating and activity and have another level of attention saying this is important, we can make a lot of steps forward. I'm going to close by probably about 6 years ago or 5 years ago, I was giving a talk about violence prevention. I realized, of course, that this community, like every other, there are many, many people in the audience who have very much experienced that personally in any of a number of ways, and it hits home for many of us. And that led me to describe a time in my neighborhood, and this totally changed my behavior. A time in my neighborhood where I came home from work, and as I got out of my car, someone approached me and put a shotgun in my chest, a full-size shotgun. And even now, talking about it, it's been a number of years, my voice is shaking, talking about it, and understanding how traumatic and how life-changing that is. And someone came up to me after I gave that talk and said, Larry, anytime you talk about violence prevention, you must talk about this, because we must recognize how personal it is for everyone. And when you, from the podium, talk about that, you're reinforcing and supporting our experience, how important it is and how important it is for all of us to overcome it. So I'm going to close with that, and once again, thank you all for your work.